Hello, everyone. I'm your host, John Rayan, and my guest today is Tony Bombacino. He is the co-founder of Real Food Blends. They make 100%. Well, he used to be. Are you still the CEO of Real Food Blends? You're the founder.
Co-founder and president. My wife's the CEO. I'm the president for the time being. We'll
All
get
right.
into that.
So it's a very interesting company because you make 100% real food meals for people who unfortunately have to use feeding tubes. They can't eat normally. And I was shocked. I mean, it's just such an interesting business, and I can't wait to hear your story. And I did do a little research on you, but you have a very profound story, and I'd love to hear about it. And tell me about your whole journey.
Awesome, man. So first of all, thanks for having me. I appreciate you reaching out. And yeah, our story starts out with our son. Our son's name is AJ. He's going to be 10 years old. And when AJ was 6 months old, he had a 45-minute seizure out of the clear blue. He was
nothing before that. Nothing happened before that.
Nothing before that. No, he was home from the hospital in 2 days. He was a quote unquote typical kid. He was a breastfed baby, and
Wow.
if anything, he was a little small, but he wasn't premature. And then my wife was visiting her mom in Ohio. She's from Ohio, and I was off fishing, and all of a sudden I get a call, hysterical, that our son's having a 45-minute seizure. As you would imagine, that would be shocking. Yeah. And one thing led to the next. I'm driving cross country. I'm in the ER, and they're doing a brain MRI on my son. And turns out he was born with a number of brain malformations that we didn't know about. And so AJ basically has a smaller brain. It's called malformations of his cortical development. So all the wires, basically your corpus callosum that help your right and left brain connect. His is a little thinner. His ventricles are bigger. All that means in our world is that he wasn't able to learn how to swallow the right way, and all these different diagnoses that came after that out of nowhere, John, is pretty shocking. But in a matter of days, we went from having a typical kid to having a kid that was having multiple seizures, and then that led to him to having swallowing issues and getting a feeding tube a month after that. And when you get a feeding tube, whether you're a kid or an adult, I didn't know this. You're typically put on a diet of traditional formulas. God love them. Formulas have kept people alive for a long time, and we never vilify formula. But we didn't know what was in it or what it meant. We never had any loved ones with a feeding tube. AJ didn't do so well on formulas. He was throwing up 10, 15 times a day, wasn't growing, was very angry and irritated by that, as you would imagine. And we just got so desperate that we kept going to our GI doctor and our dietitian saying, hey, is there anything else we could do? We would be feeding him food. Now, fast forward, he's a year old and beyond. We'd be giving him food. Can't we just blend up food and give it to him? And the mindset was, well, no, that's not what we do. You're not going to know what protein and fiber and fats you're getting and how many calories. And then think about how we eat. We don't eat the same thing for every single meal. We don't know exactly, most people anyway, some people do, exactly how much fat, fiber, calories. You eat a bunch of different things, maybe take a multivitamin. And so after many months of being desperate and AJ failing on that, we bought an expensive Vitamix blender. We're fortunate to be able to buy a nice blender and do that, and started blending stuff up at home. And we didn't know it, but that was the very beginning of what would become Real Food Blends.
Wow. So what's in a normal bag that they give people?
Yeah. It's changed a lot. I like to think we had some. I like to think we had something to do with disrupting this multi-billion-dollar industry. When we first got started, if you were to look back, they were high on corn syrup, brown rice syrup, preservatives, a bunch of ingredients you've never heard of. So cheap calories. Being in the food business, you can appreciate there's a price premium on certain ingredients. Things taste better when there's good ingredients. When you have a feeding tube, you're not tasting it. But imagine just filling your stomach up with the same 10, 20 ingredients.
It's not what God intended anyways. It's not the way to digest it properly.
Can you even imagine that though? And then even if it was your favorite meal, whether it's pizza, I come from a big Italian family, what's your favorite Italian meal, or whether steak and lobster, if you're putting that in your stomach 3 times a day, every day for months and years, at some point your body's going to say no more. And so that's what happens to people. It's called intolerant. You start getting intolerance issues. That's a easy way to say that your body's rejecting stuff. So our mindset when we started thinking about this wasn't, hey, how can we do a better formula? Our mindset was, what would we be giving our child if he was eating with his mouth? And mealtime.
Simple concept.
Simple concept. Breakfast, lunch, and dinner. And so we started doing research on my wife and I have marketing backgrounds. We were not doctors, dietitians, food scientists. We don't claim to be. And I think that ended up being a good thing because we were not embarrassed to ask dumb questions like, why is it like this? And why why can it not be different? You know, is there something we're missing from a cost perspective, from a shelf stability perspective? So we did like 2.5 years of research. We talked to food scientists, doctors, dietitians, the internet, and asked anybody that we could. And we finally figured out like there is no real reason other than that's just how it was done. It's follow the money, right? And you look at big fast food places, they didn't matter, and I'm going to leave the names out of it, but you think these places wanted to do healthier oils and healthier beef? No, consumer demand and people being able to connect on social media forced them to do that. And that's what happened in this market too. Without Facebook and the internet and Instagram and social media and people coming together, our business would not have scaled the way it did, because all of a sudden we were able to connect with tens and hundreds of thousands of people across the world, really, like us, and like people that have a love with the feeding tube. And by the way, it's not just kids, it's adults too. So we made our products for kids and adults. There's 400 plus reasons why somebody might need to have a feeding tube. Think about brain injuries, oral cancer, ALS, cystic fibrosis. There's all these different reasons why the swallowing mechanism might not work from a neurological perspective. And so long as you have a functioning GI, there's no reason why you can't. Our meals are 5 to 7 ingredients, John. 100% real food, stuff you'd find in your kitchen or at your grocery store. And that was always our mindset when we started this. Like, why can't it just be like this? And so there's a lot of complexity in that simplicity, though, because then they go
complexity and then simplicity.
Right?
It's a very good way of explaining it. Because hold on, I want to go back. I just want to, before we go on to how complex it can become.
Sure.
So, your son comes home. For months, you're giving him this stuff, and you're reading the back of the corn syrup, cornstarch, all this crap.
Yeah,
real food. Yeah, maybe giving calories, sustaining him, but is he thriving off of this? No. And plus, he was constipated. He was throwing up. I watched the video on you. So then you said, okay. So while you're researching this, are you supplementing his given meals with your own wife's concoctions?
Yeah, not at the beginning, you know. So at the beginning we were scared, you know. So
they were like, want to hurt him.
That's right. You're going to clog his feeding tube. You're going to mess up his, you know, his macro micronutrients, and they're, you know, basically they track people, or at least they used to. It's changing now with a feeding tube like robots. And I understand there are some very, very complex situations, right? So when I speak, I'm not speaking in mass, because there are very specific situations where people, like a fraction of a percent or an ounce here or ounce there, could be life or death. But for many, many people, most people, even with the feeding tube, it's a neurological thing, right? Why you can't get into the stomach, right? You can't swallow, versus it being complex GI stuff. And they scare people, you know, like that. And I'm going to leave brands and names out of it, but the industry at scale scared people because they were selling stuff that was cheap and easy and quote unquote keeping people alive, big contracts and all that kind of stuff. And again, it's not to vilify one way or another. You know, all industries progress, especially in the food industry. You hope we progress, or look at technology. And that's what's happening in this space, is that it's called enteral nutrition. So nutrition for people with feeding tubes, kids or adults. And if you look at this market, if you go back, John, 10 years ago, and then you look at over the last 5 to 7 years, you know, there's us and a couple of other independent players that have gone on to either be acquired or raise tens of millions of dollars and really change the way things are done. And we're the only ones, we're really proud to say, we're the only ones that took a mealtime approach to things. And that isn't to pat ourselves on the back. It's just a mindset of like, wait a minute, why can't people with feeding tubes eat breakfast, lunch, and dinner just like we do, so long as they have working GI and they're not allergic to the ingredients?
What do you mean by that? Hold on. I don't understand.
Yeah.
What do you mean? Other people, what do they do?
Yeah, exactly. They're treated more like cattle in the mindset. They actually referred to it as feeds. When's your morning feed or your night feed? Some people walk around with pumps and are fed 24/7, 24 hours a day. They're fed overnight. Like we used to feed AJ overnight. We'd have to put ice packs on his formula bags and feed him slowly all night, because they would say, "Oh, that's the best way to do it." Or again, these terms like volume intolerance, all that really means is your body's tired of getting the same stuff over and over again. And so when we started, we thought about something called variety, right? You don't eat the same thing for breakfast, lunch, and dinner every day, do you? No. Of course you don't. Nobody eats like that. No. And so we have 6 different meals. We started with 3 different meals, and then we built the product line over time. But we thought to ourselves, wait, most people eat chicken, and then we wanted something with fish, and then we wanted vegetables. And now we have a beef meal, and now we have a breakfast meal and a turkey meal. And again, they all have 5 to 7 different ingredients. A healthy source of fat, protein, fiber, not rocket science, but at the same time, lots of science. And nobody was taking this mindset. And you, by the way, when I say breakfast, lunch, and dinner, you can give your loved one with a feeding tube any of our meals for breakfast, lunch, or dinner. It's not like it's eggs and bacon and then a sandwich and then steak at dinner. It's just the mindset and the concept of, hey, I need this many calories per day. I eat 3 times per day like a human being. And that's really what we've been all about. That's, t- pulling back the curtain a little bit on the industry. And for people that aren't allergic and don't have super complex GI issues and that can eat food, got, this crazy thing. Why don't we try this concept of food and nutritional variety?
Okay. First of all, kudos, brother.
Thank you, man. I appreciate it.
That's a blessing. I cried a little bit when I watched your video. I got 3 kids of my own. I got 3 daughters. It's a very, very hard to go through. I can't even. It's unexplainable. You can't explain it because unless you've been there, you don't know it.
Sure.
But,
no, I appreciate it.
Yeah, you take something, right? You take something, a negative and a lemon, and you turn it into a lemonade, and you change the world. Or you change a good chunk of the people who need you. And I mean, the amount of people who are probably like sending you thank you videos or texts or emails or whatever is probably like the most fulfilling thing in the world, because what you're telling them how they feed is disgusting.
Yeah. And again, so
right?
First of all, thank you for that. And it's weird. You get so insulated. All at the end of the day, like any parent would do, when you see your child struggling, and listen, we've met lots of parents that have much worse than us. Kids they've lost to cancer, and kids that are on oxygen and can't communicate at all. AJ is going to be 10 years old. He scoots all over the house. He doesn't walk or talk and still has a feeding tube, but he's a hugger and he scoots and he does a horse therapy. And so we're blessed to have all that. But that's not to overshadow the real challenges that are there. He still has seizures and he has lots of other challenges that we deal with. And when you go through that and you have that mindset, if you focus on the bad and the challenge, you really can't get anywhere. And it's our network or our tribe, to use an overused word, has inspired us. We call AJ our chief inspiration officer, but we've got 120,000 plus people in our Facebook community, thousands of others on Instagram and Twitter, and their stories. That's been like fuel to us when they do email us or call us and say, hey, thank you. My husband was fighting cancer, or my son had a brain injury, or whatever the story is. It's incredibly touching. And unfortunately, we don't have a cure for cancer or ALS or brain injuries, but just to bring a little bit of normalcy back, like they've got to worry about doctor appointments and the next diagnosis and all this terrible stuff. At least they don't have to worry about like, what am I feeding my loved one today, and can feel good about it. So that's what's driven us from the very beginning, John. And it still does, quite frankly. And it's a mission that we can continue to drive and will for the rest of our lives.
I love it, Tony. So okay, now we know how you started, what you did, but I want to dive in to all the bullshit that goes with starting a business, especially because you're dealing with giants, right? You're fighting giants. You're not fighting other pizza giants. Like, okay, I'm in a pizza business. I'm fighting Domino's. They don't really want to destroy me, but they might want to destroy you. Like, take you to jail, maybe. No, I've heard of crazy stories like that. They are ruthless. They don't want you to touch their billions. They don't like you. You're bad for business, my friend. So tell me about it. So tell me, you guys are just experimenting in the house, but when did you actually package something together and give it to somebody else? Did you send out samples?
Sure.
How long? I mean, 2.5 years of research. Tell me the whole thing. I want to hear everything.
Yeah, for sure. It's crazy. Some of it you'll get as an entrepreneur.
I can see it.
No, I'm smiling. I'm smiling now because I'm on the other side of it, but I wasn't smiling 7-8 years ago. So we get this crazy idea. Again, you watched the video, but I'll go through it quickly. We're going to Disney World with our son and daughter. And we're like,
for people watching.
Right, we're gonna have to pack up and go shopping and blend. And I wonder if there's anything prepackaged for AJ, and there wasn't. And so we're crying on the floor at 3:00 in the morning. That's where like, there's got to be other families, other people out there that want something better and product. So that was the light bulb moment. And I was chief marketing officer at a company at the time. And Julie had a very thriving career before that and had been staying at home for a little while. And I said, let's do it. Why not us? And we're crazy enough to say that, not knowing, John, we knew nothing about the industry, how big it was, who were the players, nothing, right? Nothing about insurance reimbursement. That started the clock going 2.5 years. It wasn't until the beginning of 2014 where we figured out things like packaging, co-packing, finding a manufacturer that could do everything we need to do to source the ingredients to make the food. So our food is shelf stable for 3 years from date of production.
How is
But
that possible?
yeah, it goes through what's called a high heat retorting process. So basically, it's how do you keep all the good stuff without, keep as much of the good stuff and get rid of all the bad stuff. And then it goes in specialized pouches. And it's once you open it, you got to put it in the fridge in a couple hours. You got to use it just like food. There's zero fillers, zero preservatives in it. So we knew nothing about that process. We knew nothing about the players that did it. Because if we need it refrigerated or freezer trucks, the financials wouldn't have worked. So Julie and I, not only do we spend 2.5 years figuring out like how to bring this to market and everything, we had to figure out, we were digital marketers and marketers. We knew nothing about the supply chain and about all that and building a tangible product. And so because we were marketers, we thought to ourselves, hey, we need to really get this out to people and in front of them. And that's when crowdfunding was getting really big, 2012, 2013. And we decided to do a little crowdfunding campaign, not for the money, because we had some angel investors in our back pocket already, thankfully, some friends and family that had done well for themselves. So we raised about $600,000 in angel investments. And that helped us keep going because we were funding it for 2 years out of our own pocket. And once we did that, it was amazing. All the comments we were getting, and people were signing up, right? And kind of pre-ordering for the crowdfunding. And we started delivering the first meals in February of 2014. And we did our first full production run soon after that. And we did 90,000 meals. We did 15,000 meals in the first one. I'm fast forwarding. So think about that. We had 3 different meals, 5,000 per SKU. Yeah. Our co-pack manufacturer, again, leaving the names out, works with some of the biggest CPG brands in the world. And they're doing millions per hour, and they're like, sure, we'll do this for you, because we begged them for 8 months and they got tired of us. And it wasn't cost effective. It wasn't positive ROI in the first one, but we sold out in less than 2 weeks. And right.
So I want to slow you down. I want to slow you down because there's so many questions to unpack in this little moment we have here. And by the way, this is so exciting because, I just love this stuff. So,
Me too.
So your son was born what year?
March 20th, 2011. So it's almost his birthday.
All right.
Yeah.
Tomorrow.
No, 20th.
Oh, 20th. It says 11.
20th, 2011. Yeah.
Gotcha. So 2011, he's born. 2000. You came up with the idea. You were blending and making stuff in your funding it yourself from 2012 to 2014.
You got it.
Wow.
Yep.
So you guys were depleting you guys quit your jobs, or you stayed in your work? Were you still stayed in your jobs?
So my wife had quit her job before AJ was born, and I was working, but then I went through a number of career ups and downs. So there was a point where we went from making very large salaries to zero, and all of a sudden, all those life savings, again, we were fortunate to do it, but into the 6 figures walking out the door. And we certainly had that point of, what are we doing? And many times. and obviously I'm putting it lightly, right? I'm sparing you all the husband-wife arguments and crying and
well, you have a sick child at home.
That's yep.
It's like this is not a we're having should we stop going to the fine dining restaurant and start going to McDonald's? We're talking about we have to support him.
That's right. And we have an older daughter, by the way.
And a beautiful older daughter, I saw, of course.
AJ has a sister who's older. So we have 2 children. We both had thriving careers. All of a sudden, our careers are both put on pause for various reasons. We have 0 coming in and lots going out. And at the same time, our son's having seizures, and we're getting all these diagnoses thrown at us. And we're trying to start a company.
Yeah. I love it. You're chaotic. I love it. I mean, in a good way, in a good way. You got to. You're staying busy. You didn't feel sorry for yourself.
Not at all.
You took the bull by the horns and you turned lemons into lemonade. So you're blending stuff in your kitchen. You're coming up with 3 different SKUs that makes 3 different products that you think your son would enjoy. Chicken product, whatever. 3 different kinds of products. You blend them in your Vitamix, which is awesome, by the way. Plug the vitamin mix. And then you're putting it in the tube and you're feeding it to him and you're seeing his reaction to it, make sure he's okay. Now, are you feeding it in like a less than, is it take an hour to feed, 10 minutes? How long does it take to feed somebody?
Yeah, It used to take them a long time, and it does depend on the person, how transitioned they are to food. But literally, man, like I wish I should have had the syringes for you. Like think of big, like 2-ounce syringes, like
Sure.
when you have a
The ones you
tube,
give your kids when they're sick,
there you go. So he
bigger
has
ones.
a connector that goes in his belly, almost looks like a beach ball connector, and then you have like a little thin tube, and you push the food in there. So AJ can get 14 ounces of food, 14 ounces of water in like 30 to 40 minutes, right? Like not now he does. When we first started, we would give him like a half an ounce of applesauce because we were so scared. And then we started, okay, wow, he didn't throw up. Wow, he's going to the bathroom. Oh my God, he didn't die. You know, like food in his stomach. And slowly but surely worked in different types of foods. And Julie really, you know, that was all her, man. She really figured out the recipes and did the research with the dietitians and food scientists. And then she and I at night would geek out and kind of be like, well, what about this? And what sounds good? And what blends together? And where can we get, you know, proteins and fibers and fats and also still make it cost effective, right? Because this thing couldn't be $25 a pouch or nobody would pay for it.
Okay. So you decide that this is a business. There's other people who need this.
Yep.
I need to figure out the legal ramifications.
Yep.
I need to figure out packaging. It doesn't have to be pretty, but it is pretty, but it doesn't have to be pretty. So packaging, you got to find somebody who's going to manufacture and put it in this container.
Yep.
And you got to make sure how long it lasts. You know, there's some, you know, you have to be very careful because if you make a mistake and you get an E. coli outbreak, you screw,
right.
They'll die because they're already sick.
That's right.
A lot of them will. So,
yep.
So people are probably afraid to take this on a little bit, right? Is there like a higher risk? Do they charge you more because this is more sensitive?
Here's the deal. It's just food, right? And so our co-pack manufacturer, it's not our meals are not a medical food in any way. Yeah. And our co-packer works. Yeah, they have USDA and FDA people on site. And they're working with huge brands that if their products were contaminated would lose a lot more money and be a lot more harm than us. Not that, you know, so we have zero tolerance, right? So the levels of quality and QA and safety standards are insane, but they already were at the manufacturing partner that we partnered up with before we went with them. You know, it's beyond what you could even imagine.
You live here in Illinois, right? I'm in South Barrington.
Nice. So I grew up on the south side of Chicago. We live in Northwest Indiana now, right on the other side of the lake in Chesterton, Indiana.
Gotcha.
But I lived in Chicago from age 1 to age 30. Lived in Lincoln Park. Lived in Ukrainian Village. Lived in Burbank.
All
nice. Over.
Oh, nice. Yeah, I saw the 708 number. I was like, oh, he's a
yeah. I kept it.
So did you the company that you went with? Did you to actually create the product and bag the product? Are you still using them today?
We are, believe it or not. And we back again, when I tell you, like big co-packing manufacturers do not like entrepreneurs. You know, that call them every day and say, hey man, I got the next great barbecue sauce. Can you make me 10 bottles? And they're like, go away.
Yeah.
But honestly, we bagged and they finally, I think they finally got tired of us. And, you know, 7.5 years later, you know, tens of millions of, you know, in products later, and they're still our partner. It's kind of amazing because they were a family-owned business at first. Again, leaving names out a lot of things, but they do things at scale. They grew with us. They helped us grow. They helped us learn a lot. They helped us with R&D. They helped us with safety. It's been really an unbelievable partnership.
Okay, you don't want to say what company?
Yeah, no, not right now.
Okay,
I mean,
that's fine. That's fine. I don't care.
In the industry will figure it out over time. There's only a handful of them.
Yeah, so that's what I was going to ask you, right? Yeah. So when you're trying to get a company to make your product and they say you're too small for me, you know, you're actually insignificant.
Yep.
Why did you continue to go back to them? Is it because you believed in that company, yep, or you lived near the company, or you didn't have an option because there's not a lot of companies? What was the reasoning?
Yeah. So
how did you know to keep going back?
A and C. So it had nothing to do with geography. It was more about there are only a handful of people in the world, really, but in the country that had the capabilities to source the ingredients, had the machinery to do the blending, to do the retorting, and had the safety protocols and all the kind of things that would be true, and basically could handle what we needed. And we talked to all the other players, and it just came back to they had a lot of experience with great CPGs, that we consumer packaged goods companies that we respected, and just kept chipping away at them, man. This isn't something that because what you talked about, we couldn't do this in our kitchen anymore. You know, we're not making 15,000 meals in our kitchen and don't have the ability to do, we don't have retorting machines in our basement. You know, so it really was a capability thing that our business could not have happened with one of those players. We couldn't like go to like a commercial kitchen and just make it on a stove and put it in a pouch.
No, and it's unsafe. It's scary, and it's not scalable. And
That's right.
So prior to you going to this company and them saying yes, which took 8 times, whatever, you annoyed them until they said yes. Which is, my daughter's asking me for a parrot, which I don't want a parrot, right? I don't want a goddamn parrot in my house. I don't want a parrot in my house. But I wake up in the morning, she's got to know it. I want a parrot. We're gonna have a parrot. She's like, it's like time warping. She's like making me get a parrot, and I'm like, I want to tell her to not do that, but this is like the most important element of being a human is knowing what you want, believing you can get it, and then just being relentless. Which is, you know what I mean? So like, why should I take that away from her?
Sure.
I'm probably gonna end up with a parrot.
and that's how I ended up with a dog, because my daughter was a good pitch woman, and she kept at it. She knew she wanted a dog and why, and pitched me on it.
So before they started manufacturing, were you guys making for outsiders? Were you making packaged? No. So you were simply taking care of yourself. You did not want to even think about it because you were afraid of what could happen if you made a mistake.
We had bigger, like we knew. So once we got to this point again, we're very lucky. We had the ability financially and otherwise. We had a network. We had pals that, business strategists and mentors that were helping us. And we knew the market size, right? So this was a multi-billion-dollar market. And so we knew if we could get this to market, we felt good. Julie and I both had 15, 20-year business careers before this. We had worked in companies like startups that we grew to either raise money or go to IPO. So we knew the business part of it, and we believed in the brand. We believed in the mission. And so we weren't trying to do this small. Our mission from the start was, we're going to go do something and make a difference and try to change this industry.
Gotcha. So let's I have so much to unpack after you start scaling, but that's very important. You guys didn't go out and start selling door to door because this is kind of a particular thing. You really can't mess around with that. Plus, you knew that it was going to be big one day, and you needed to start strong before somebody else stole the idea and
right.
So scaled it. So when you say mentors and people with strategy, tell me about that. Who did you talk to? Because who the hell do you know that knows about this? I mean, you know what I mean?
Yeah.
Did you go looking for them, or did you happen to know somebody?
Yeah, a little bit of both. So when I say mentors, I grew up on the south side of Chicago, blue collar family. I was the first person to go to college in my family. Julie grew up very similar, blue collar family. And we both went on to educate ourselves, and from a very young age, kind of built our networks of mentors. Could have been teachers, could have been former bosses, people we met at industry associations that we donated time on or gotten boards of. And that's what we did. We stayed in touch with a lot of people that were already where we wanted to be, just like you've done, people that were CEOs, CMOs. And we didn't start with people that had food industry experience. We sought out consultants, like specific people that we needed. Hey, we need a food scientist to help us with the viscosity of the meals, or how we can get the right protein or fat. That's important, but that's kind of the commodity in this business. What isn't the commodity is, what meals should we launch first? How much money should we raise? Who should we hire first? Right? What should be our name and our brand and our look and feel? How do we approach B2C versus B2B selling? Those are, no matter what you're selling, those are the really important questions that can help you scale or fail. And that's what we did. We were constantly having conversations, even that 2.5 years when we didn't have a product in market. We were going to the industry conferences. We analyzed like where the products were going to be sold, how the market moves, who were the influencers. So we figured out that clinical registered dietitians were actually the influencers in this market, and not the GI doctors, because they're the ones that would recommend our products or not. And so we started to go to all these, just listening and walking the floors and seeing how people responded to the big formula companies versus some of the new products. And that was like gold, man, because that helped us build our brand and our company name, Real Food Blends. We couldn't even believe that was available.
I know. I was like, what a great name. You know what the hell it is based off of the name. That's how you know.
That's right. And we did that purposely because we went back and forth. And if we were just doing some B2C fun brand, sure, we could have made up a name and had some fun with it. But we were competing against giants, as you put it. And we knew that we had people really quickly, and we didn't have hundreds of millions of dollars to spend on marketing or get the word out. If somebody saw our logo, we wanted them to know, hey, Real Food Blends, meals for people with feeding tubes, real straight and to the point, and that it's just food and real food. So anyway, kind of with the mindset going back to all this, we looked at mentors not just as, hey, help me. It's we went to them with a humble mindset of we don't know everything. We knew we needed an accountant. We knew we needed an attorney. We knew me and Julie are marketers. But we tapped into friends and mentors that we met over the previous 20 years, John. And then we did the work. You know, we wouldn't just go. I mentor people now, and so does my wife Julie. And you know, it's great when a mentee comes to you with an idea or a problem and wants to vet it out with you versus like throwing a problem on your lap and saying, help me, you know? And that's what we try to do. We would go to our mentors and not say, oh my God, I don't know what to do. We would say, hey, we're in this market. You know, here are the current products in the market. We're trying to figure out what meal we want to launch next. You know, if we do this, here's the risk. If we do this, here's the opportunity. So it was really a strategic conversation because a lot of these mentors are super busy and successful, and they only got 30 minutes for you. And if you don't get what you need in that 30 minutes, you kind of like wasted the opportunity. So we're firm believers in building a network of mentors and also being mentors ourselves. And that was critical to us because we didn't have tons of money to go out and pay super senior executives. It was really Julie and I for a long, long time. And our one first intern employee, Megan, like that was it for years. And then like year 2, year 3, when we start to scale and we're profitable and then became a multi-million-dollar company, then we had to figure out how do we want to approach the sales force? Because Julie and I knew from the beginning, we didn't want to we wanted to approach it differently. So every one of our salespeople, who actually call it business development people, are clinical registered dietitians by trade. So they're not just salespeople, they're people that can talk to science. Because again, we did the homework for a couple of years and figured out that it was the clinical registered dietitians.
Sources of leads.
That's right.
You recommend everything. Everybody listen.
And if you're a dietitian, right, it changes the playing field. If you got, you know, Joe, the sales guy coming in and has no experience, clinical nutrition experience, and just trying to sell you a product, and you're a dietitian, it's very different versus you're talking dietitian to dietitian and can understand the science behind it and understand the complex needs of a given patient or person. And so I think that was a good thing that we did. And all these little things, you know, there's 9 million decisions that you have to make when you're an entrepreneur along the way that you don't see, and people want to high five you years later, and it's awesome. But it's just like there's a band when they say, oh my God, they're an overnight success. And, you know, no, they've been playing in the basement for 20 years, you know?
Yeah. I was the podcast I was on Friday. I had a gentleman, Chris. He has 14 salad restaurants in Dallas, Texas.
Wow.
And they're doing 16 million a year. He started it. Yeah, but you know, they're like, oh, overnight success. Yeah, the last 20 years of hell. Yeah, you know, so
exactly, man.
They have no idea. And then we were talking about how, you know, you and your wife, you know, your ideas are flowing constantly. So like, you know, you have probably 7 million times you've had to say no.
For sure.
As opposed to like that 1% where you say, okay, yeah, that's a good idea. Let's follow through with it, because it doesn't take you away from what you're doing. There's so many good ideas, especially when money starts coming in, you have a little more flexibility.
Yep.
You know, it's hard to say no. I'm really bad with that. I'm trying.
And we're marketers, right? So we're scattered by nature.
Exactly. Okay. So were you the first to market?
So we were the first to market in our specific doing meals. There was one other independent, again, I keep leaving names out, that was doing like a healthier formula, if you will. Like they took the vegan, plant-based approach, but it was still a formula. And there was only one, right? They didn't have variety. And then another player in the market that had more of like nutrient shakes, if you will. But it was all the other players before us were various plays off of formula. Eat the same thing for every meal. It just, you know, healthier ingredients, etc. Nobody was taking a breakfast, lunch, and dinner, 6 different meals, 5 to 7 ingredients. So a little bit more of that simplicity in the complexity is that if you look at the other things on the market, all of them have 10, 15, 20 plus ingredients. Ours have 5 to 7. And again, the reason for that is people that are eating our meals are on lots of medicines or have allergies. And the more ingredients you have, the more likely you can have drug interactions and negative things going on. When you look on the back and it says, you know, chicken, vegetables, olive oil, water, and fruit, okay, pretty straightforward. You know if you're allergic to those or not, if they're going to have drug interactions. So yeah, we took a bit different approach. So there's certainly a couple other independent players in the market, but we don't do anything like them.
What's your price point versus what their price point was?
Yeah, we're cheaper. And
Oh,
yeah. We're so when I say cheaper, I'm talking about the other independents. So when you talk about the two, like the big formula companies that were selling to traditional formulas, we're certainly more expensive than them. And I'll give you more context there because they've had to since kind of answer in the market and launch healthier versions of their products as well, which are now closer and B2C and B2B to our price, which is awesome. But it's important that you know that when we started, we knew that B2B, when I say B2B, I mean, we sell our meals wholesale to medical supplies companies, home healthcare companies, and people like that, because they're covered by medical insurance in many cases. And we thought it was going to take us a little while longer. We started getting our meals covered within 6 months by some players, and not by all the providers. But the way it works is, I don't know if you've ever heard of like Medline. Medline's in the northwest suburbs of Illinois. They're a multi-billion-dollar privately held medical health company. They do everything in medical supplies. But when you think of Cardinal Health and you think of McKesson and Quorum, these are the big medical supplies companies. We work with all of them now. So they buy our meals wholesale, and then they turn around and sell them to nursing homes, to doctors' offices, to hospitals, to other what's called durable medical equipment companies. And they take care of all the insurance reimbursement on the back end. They own the insurance contract. So we don't have to deal with any of that. And so it's really an amazing business that like B2C is still 12-15% of our business. We have a great business through our website and through Amazon. It's great for trial. It's great to build direct relationships with our customers. So we always understand on the front side, what are their needs? What are they struggling with? And then so many of them then go on to get our meals covered by medical insurance, which is what we want. Even though the margins are thinner, it's at scale because those people aren't price sensitive anymore because the meals are covered by medical insurance.
exactly.
And so, yeah, so that's what moves that market, if you will. But yeah, there's other players in the space, again, multi-billion-dollar market. And I think the three independents have completely changed the game.
That's awesome.
Yeah.
So I love it. So 2014, you scale, you get your first 15,000, 5,000 per SKU, 3 SKUs, 15,000 total. You're sold out in 2 weeks.
Yep. Yeah, this is a fun story. Let me tell you that.
Tell me now we're ready to talk about the scaling part.
Yeah, this is the most exciting part of all, because sometimes you look back and you're like, holy crap, that really happened. So we do the 15,000, sells out, and we're like, oh my God, that happened. But then we're also like, oh crap, we're out of stock. Now what? And at this point, we still are funding a lot of it out of our pocket, and in such a way, because we didn't raise a lot of money, and we're funding it in such a way that we're paying for stuff before we're selling them, because we didn't have a line of credit with our co-pack manufacturer at this point.
Wait, didn't you get 600 grand plus the crowdfunding?
We only raised like 10 or 15 grand through the crowdfunding, and the 600 grand came through at the end of 13 into 14. We didn't raise it all at once. So we didn't have everything all at once. Right.
Okay.
So, and that was a little bit by design, because we had the ability to, again, we were fortunate. We had the ability to do that. We wanted to give away as little as the company as possible, because obviously terms, when you're a young company, you can't demand a big valuation. So we did a decent job with that, but we do that 15,000, and then we're like, well, what are we going to make next? And we decided to do 90,000, because we're like, wow, 15,000. So 30,000 per SKU. Now we're talking $350, $4 a meal at that point, right? So start to do the math. You're starting to talk about hundreds of thousands of dollars. They sold out in the same time period, John. So now we blow through 90,000, and we're like, wow, we got a business.
How are you selling this? Are you selling this through your website?
Or through our website and through Amazon. But then that's where we got our first B2B order in that time frame from Medline, was actually the first order, where we start getting $10,000, $15,000, $20,000 orders at a time.
Now stop. Stop.
Yeah.
Now you didn't have. This is so like I'm living through Shark Tank right now, right?
Oh, it's crazy, man.
When you watch Shark Tank, you're like, I understand, I get it.
Yeah, for sure.
So okay. So when you did your 15,000 or your the 90,000, and it sells out in 2 weeks or 3 weeks.
Yep.
You're not marketing it besides Amazon or your website. Are you spending Google ads? Are you doing
barely?
So this is just pure. Are you making money on each piece?
What's that?
Are you making money on the product? Like, so you're making it for 4. Are you selling it for 10?
Yeah. Just barely. No. We were selling them. If you even look at our website now, they're still only like $4.16 a meal. Okay. That's at retail. A little bit more on Amazon because of the fees. And then on wholesale, it's less than that.
Yeah.
So at the
You
beginning,
need to scale up to drive the cost down.
that's exactly right, man.
For $7.
Yeah, that's exactly right.
Oh,
Yeah.
wow.
And insurance reimbursement, the way that works is very important because that is what it is. That doesn't change based on your ingredients or if it's organic or gluten-free or whatever. So we had to study that, and we had to bring a product to market that was the right calorie profile, the right density, the right the right protein, fiber, all that kind of stuff, but also that the financials work, because who cares if you bring a great product to market but it costs you $10 and you can only sell it for $4. That's not a very sustainable business.
Oh.
So that all went into it. But yeah, in selling it out, that's when the B2B order started. But again, it's just Julie, Megan, and I at that point. We have no sales team. We have no huge marketing budget. We're just doing guerrilla marketing. We're going to a couple events here and there to get the word out. And that's what started happening. And so this is the cool part. So then we're like, oh wait, we're going to be out of stock for like a couple months now, because our manufacturing partner was like, great that that 90,000 is a big deal to you, but remember, we're working with huge companies and we don't have any space in our production schedule for you until this time. So we kind of panicked. We're like, all right, what are we going to do? How are we going to keep these people engaged? And that's where we put our marketing hats on. And we started really building our social media presence and email, and start building a dialogue and letting them behind the curtain and thanking them and telling customer stories. Like, it's because of you that we're out of stock, right? And we're changing this industry together. And we wrapped our hands and arms and brand around our customers. And instead of a company selling products to people, we were a family living the same lives they were. Like, hey, we have a kid with a feeding tube too. We're figuring this out together. We want to make this bigger and better for you. Please be patient with us. And then a month goes by, and then we're like, wait a minute, there's all this demand. Why don't we let people pre-order for the next production run? And so we started letting people pre-order, and people pre-ordered tons and tons of meals for the next production run, which by the way was 120,000 meals. And after that was the least amount of meals that was still in 2014. And after that, you can imagine, right? So you go back 7 years ago, hundreds and hundreds and hundreds of thousands every time we produce. And that's when we had 3 meals. Now we have 6 meals. And yeah, so, we did a few $100,000 in sales the first year. We grew 7x the second year, and just went into, multi-million dollar profitable business.
Before you sold, can you say what your sales were, or no? You don't want?
Yeah, no, we don't. We unfortunately we don't. Yeah,
it's all right. It's all right. I figured I'd ask.
You gotta ask. Right?
I gotta ask, right? But
it's substantial.
Were you and your wife happy with the exit?
Yeah, man, it's very, very special, great thing, and not only just financially, but also the people are great, man. And I know everybody says that, but I'm saying it from the bottom of my heart. I've worked with these folks for almost 6 months now, and top to bottom, to the CEO, head of HR, the entire executive team. So the acquisition was done through Nutricia, who's part of Danone. Danone being a multi-billion dollar company, but they're a B corporation. They're all about food. They're doing a ton of research and spending a lot of money to try to improve all of their existing products. And to bring on a company like ours, I think is a great signal to the market that they really believe in doing things in a better way and the importance of nutrition and real nutrition. So yeah, we feel really good about it, actually.
So now you and your wife, she's CEO, you're president. Okay.
Yep.
You're running this company. You don't own the company, but you're running the company. So you're getting a good piece of it, but this is going to allow it to really go probably global.
Oh yeah, man. And who knows exactly when or how they'll do that, but we're having really exciting conversations already in terms of product development, R&D, scale. There's unbelievable stuff will happen in the coming years. And the exciting part, I think, too, is they really appreciate the brand that we've built. And so sometimes when acquisition happens, it's just to kind of get the brand and move on and kill it. And that's not the plan here. I think they're really excited about to scale what we started. And I think they want to continue to honor AJ's legacy and mine, Julie's legacy. But they have a lot of salespeople and marketing and R&D abilities. So yeah, there's going to be some cool stuff that happens in the coming years.
So did they approach you, or did you approach them?
Yeah, no, we were proactively looking to do something. So this is a tough thing. If it's really strange when people ask me that conversation, like, why are you selling now? I mean, you scaled 50x and you're profitable and you're doing great things for the market. And I say, you really have to come live at my house for a week or two to understand the answer to that question. In the last 3 weeks, AJ was in the hospital with severe constipation. He had some severe seizures. he doesn't walk or talk, and he's getting bigger, right? So AJ's needs are very complex, and running a large company, national company with big competitors requires you to be all in, you know. And before COVID, Julie and I were gone constantly to different conferences, meeting with customers, running a business, hiring, making product decisions. And I think we both realized is, hey, husband and wife been doing this for 7+ years, and our son needs us, our daughter needs us, and we just felt it was a good opportunity. We weren't the right people to run the company anymore based on our family dynamics. And that's really what it came down to. So we actually, it was a proactive situation where we hired a partner to represent us and to find the right partner. Yeah.
That's yeah, smart move, I think. I mean, good for you. You know, you can't forget why you started the business, right? You know, you can't get bogged down by how awesome it is to grow a scale company. You got one at home that you need you. This is how it all started.
That's right, man. Yeah,
Yeah.
and now and to be able to get in a situation, not be greedy, and to recognize that, hey, you built something special for the people that work there, and hopefully for a lot of other people to benefit from the products in the company. But at the same time, you have to do what's right for your family still. And you know, this will now put us into a situation where we can help a lot more people personally. You know, we spend a lot of time and money with local charities and places where AJ goes. You know, we have a lot of plans personally that this will allow us to do as well beyond the company. So this is just the next step in a lifelong mission. You know, AJ is going to need 24/7 care his entire life, and there are so many other people that are not in a financial situation that have all these challenges and more, but then don't have the support network or education or financial. So this is really a springboard to allow Julie and I to make an impact on a much broader level.
Yeah, and that's beautiful. I mean, you know what? Absolutely. To live is to give. I mean, you know, it's such a simple statement, and it sounds like bullshit, but it's not.
No, it's true. It's true though. Like, you know, you've been around long enough, and so have I, and come from the south side of Chicago. I have a pretty good BS meter. It's just, we've met so many awesome people because of this that we would have never met if AJ didn't have his challenges. So, hey, would I love my son to be able to walk and talk and not have a feeding tube? Yes. But this is my path and journey now. For whatever reason, it's changed us for the better. It's changed my daughter, and we are very fortunate. And my life is much more fulfilled than it was before, when I was, you know, doing digital marketing and ad tech. God love all my friends in digital marketing and ad tech.
I know. I'm in the pizza business, and I'm in
Right.
the marketing business. You know, am I changing the world? No. Am I
Hey,
making?
man.
Do I enjoy what I do? Yes. But you know, I have actually another idea, a business idea that my wife and I'm very excited about. I actually started. I
Awesome.
haven't launched, but my point is, why am I mentioning it? Because it's healthy. It can change the world in a positive way. It's nothing like as good as yours, obviously. It's as no life change, world changing. I mean, you're helping people who need it, who are like not, you know. I just imagine, you know, when my 2-year-old, I had a 2-year-old daughter. She's 5, but she was behaving like hyper, and I was like, what the hell's wrong? You know, what's wrong?
Yeah.
We started to worry a little. Like, is there something going on? Because you know, between 1 and 2, she was a terrible child. And I say this to her sometimes. I'm like, hey, you were bad. You owe me. Screaming this and that, and then we changed her food. Right? Everything changed.
Isn't that unreal?
Everything changed. So it's so important, you know, for kids. They're so
Great.
sensitive, and now you know they can't speak for themselves a lot of times. They can't tell you what's going on.
Yep.
So I love it. Kudos
That's
to you, big
exactly
time.
right. Yeah, man. Listen, I appreciate it. It's like I said, when you look back on it, sometimes like we sold the company 5.5 months ago now, and just yesterday morning, Julie and I were kind of looking at you like, wow, did this all really happen? Because it happened in the backdrop of COVID, and while you're going through a process like that, you know, you're doing a lot of stuff. You know, you there's a lot of stuff you can't share with your broader team while that's happening, because it might not happen, and you don't want to distract people and scare people. And so you're running a business, you're trying to figure out the next evolution of the business and get the deal done. And then AJ's has his issues at home, and you know, it's really a unique thing. But it's also, I always say, it's like, what a cool blessing. You know, my dad worked with his hands and hard labor his whole life. I always tell people, I'm not digging ditches or putting on roofs on houses in 100-degree weather. Don't feel sorry for me. I get to work on really cool, meaningful work, and I'm just fortunate to be able to do it. And it's exciting and fun from a business perspective. and then all the emails and all the other stuff, that's just extra stuff, man. But it's turned into friendships. You know, I don't feel like we're just like a company anymore. And so yeah, it's very surreal. And at the same time, it's you look back and you're like, wow, that really happened.
A lot has happened. A lot has happened. Now, two last questions. Number one, how did you ever try and get on Shark Tank? Because I think you guys would have killed it. Number two, when you were selling the business, when you decided to relinquish control,
Yep.
how scared of you? What did you do to make sure that they did not screw you guys or destroy the business on purpose?
Yeah. Both good questions. So let me take the fun one first, and I'll talk to you about the lawyer part. So we were all, Julie and I were, again, maybe we're just crazy enough, for lack of a better word, to think that we didn't need that. We watched Shark Tank as a family from the very beginning, all the time, and we would rate the entrepreneurs and the judges and be like, oh, that judge is being a jerk, or man, that person really missed an opportunity to talk about this. But anyway, we're nerds like that. But we always said, we kind of said, listen, Shark Tank's great, but it's a little bit like the American Idol for entrepreneurship. If anybody knows anything about entrepreneurship and fundraising, that's not how it's done. You don't walk into a room, it's like, all right, pitch me your idea. I'm going to try and screw you on the metrics, and you're going to be on national TV. Don't mess up. And so we were lucky we didn't have to do that. We knew people that were successful financially. We put together a presentation. We were able to raise money, and we did not have to go to Pat. Now, we recognize the scale aspect of it, but we weren't selling a commodity type product, right? Our product wasn't relevant to the masses. We weren't selling a pillow or something that was relevant to everybody. So we're like, hey, let's go on Shark Tank to talk about tube feeding nutrition. It just, we didn't make that a priority. But what the funny thing about that is, I was having lunch at Joe's Crab in Chicago one day with my buddy Kevin, and he was always telling, you got to get on Shark Tank. We walk around the corner, dude, and Lori Greiner is sitting in the corner holding court with her laptop, with, like, you can tell she's meeting with different entrepreneurs. And we had been in there over the years a number of times, so we talked to the waiter, and we're like, Kevin's like, hey, if my friend wanted to go up to her, what would be the right way to do it? And he's like, give her a second till the next client's gone, and put your phone number on your card and just say, hey, Miss Greiner, da da da. And so I did it, and never heard from her, but that was the closest brush to Shark Tank. So anyway, and then back to, how did you find the right partner and make sure they weren't going to take your company apart? Man, we had so many conversations. I think there were 300 companies on our potential list to potentially partner with and sell to, and we just whittled down based on who they are, what they believed in, what their plan was. So we kind of interviewed them too, right? We would ask them, what's your plan with the team? What's your plan with the brand? This is really important to us. And you can tell, some people would tell you what you wanted to hear. And then other times you can tell, all right, these people have thought it through. They have a game plan. They're not just looking to add money to their bottom, to their books because they're a publicly traded company. And we have a great lawyer. And my buddy Bobby has been my attorney for 20 years. He's still our attorney. He's just a smart cookie. He's always protected our best interests. So, at the end of the day, unfortunately, it's not, the 1930s where you handshake and everything's good when you're talking about, big numbers and deals. And it's good people. It was good people coming together, good people. It was a process of elimination. And that's really, it's no other, there's no other magic other than that, John. We had many Zoom calls. We still haven't met the team that acquired us in person. Believe how you like that? Yeah. I tell people I'm going to write a book on how to sell your company in the middle of a pandemic.
No, you should definitely write them. Have you written the book yet?
What's that?
Have you ever written a book?
I haven't, but that's definitely on my list, man. I love to write and love to do public speaking, so I'm hoping I can do more of that in the future. But imagine that
away, right away, brother.
I appreciate it, man.
What an interesting story.
But imagine that we haven't, like, our CEO, so we kind of reported to the CEO of nutrition. We have never met him in person.
That's bonkers. I never in the history of time has there been a time where you can sell a company, still stay on as one of the leading executives, and never actually physically touch the hand of the person who's doing it. Right. Break bread with a person. How do you do such a big deal and never break bread with somebody? I don't understand that.
And we were dealing with people in France, like M&A people in France, and people on the East Coast, and it was crazy. But at the same time, it just happened. Like we clicked from the beginning. And so, yeah, there was definitely some back and forth on, terms and the deal and all that, but they were fair, we were fair. And I think everybody's interests were aligned, and it just made sense from the beginning. And so that's why it happened. If we didn't force it, we were willing to walk away. We didn't have to sell the company. We were a super profitable company. And so I think because of all these different variables at play, it just came together. The right people were involved. We had the right legal representation. We had 20 plus years business experience. We weren't going into it blind or, green, if you will.
Naive. Yeah.
Yeah. We kind of, we'd been through a lot already. But at the end of the day, man, we're very lucky. We many people work their tails off and do a great job and have great companies and can't find the right outcome. So we're excited. We're blessed, excited about the future, excited to see what the team is going to do next, with us for a while longer and then beyond us. But I think we'll keep in touch with them for forever, really. I respect the business people that I've met already there.
That's awesome.
Yeah.
Tony, I appreciate you coming on, man. It's been an honor to have you on. I'd love to talk to you. I hope to stay in touch with you.
Yeah, me too, man.
If I ever come to North, we'll break bread in Indiana, or if you come out here.
I'll meet you in the city.
Yeah. I got a pizza place on Belmont and Pulaski.
Come on.
Yeah. Come on over. We'll have some pizza and we'll talk, and you'll meet my brother. But you got a great story. Write that book. Come back on the show and promote it on our show.
Thank you.
Realfoodblends.com. I'm
got it.
Very, very impressed with your business. And I appreciate you coming on, man.
Yeah. Thanks for giving me the platform. Nice to meet you. And I look forward to meeting you in person soon.
Definitely. Take care, man.
Right. Take care. Bye.